Thorax 2. Thoracic cavity, intercostal spaces, and the neurovascular bundle. If you have not fully removed the pectoralis muscles and fascia overlying the intercostal muscles, do so now. Removal of the anterior thoracic wall. Using the scalpel, mark the following on the anterior chest wall. From the sternal angle, along the first intercostal space, to the mid-axillary line. Along the 8th or 9th intercostal space, using the bone saw or rib cutter, cut through the ribs in the anterior axillary line, and remember to cut only through the bone, not deeper, to avoid cutting the lungs. Identify the following intercostal structures. Note the upper intercostal spaces are usually best to demonstrate the following detail. The external intercostal muscle. These muscle fibers course downwards and medial, similar to the external oblique muscle. The muscle belly fills the intercostal spaces posteriorly and laterally, and anteriorly it becomes a membrane. Identify the internal intercostal muscle. These muscle fibers run at a right angle and deep to the external intercostal muscle. The muscle belly fills the intercostal spaces anteriorly and laterally, and posteriorly it becomes a membrane. The innermost intercostal muscle. This muscle follows the same course as the internal intercostal muscle. Cut a window through the intercostal muscles, just lateral to the sternum, in the first intercostal space. Identify and transect the internal thoracic artery and the internal thoracic vein transversely in the first intercostal space on both sides of the sternum. Identify the following structures: the right lung, the left lung, the parietal pleura, the mediastinum. Dissect out the internal thoracic artery and vein and follow their course. Identify the following: the internal thoracic artery. Also identify the anterior intercostal artery, which is a branch of the internal thoracic artery. Identify the internal thoracic vein. Now bluntly dissect out the lungs with your hands. Once you have freed them as much as possible, incise the lungs at the hilum. Remove the lungs from the thoracic cavity. With the lungs now out of the way, dissect out the intercostal vein, the intercostal artery, and the intercostal nerve and the posterior chest wall.